We're joined now by Dame Donna Kinnear, the Chief Executive of the Royal College of Nursing. Thank you very much for being on the programme today. So what do the frontline nurses and doctors need to deal with coronavirus, and are they getting it?
So nurses need two things. They need to be tested for the virus so that they can know whether they need to take time off work or whether they can continue to work. And they also need proper personal protective equipment to be able to do their job well.
So just to take those two things in turn, firstly with the testing, the government's saying that it's going to be rolling out testing, trying to ramp it up for those frontline staff. Many people will be wondering why on earth this hasn't happened sooner. What's your take on that?
And I believe it should have happened sooner, but we are where we are and we need it now. So nurses are, every day they carry out services to patients or care and treatment to patients, and they will be less than 1 metre away. So they particularly need to know whether the person that they're dealing with, whether they themselves have been infected with COVID-19, so that they can take the appropriate time off, but also protect themselves and their families.
I know it's hard to put figures on these kind of things when things are so busy, but do you have any idea about the proportion of nurses or NHS workers more widely who are having to take time off, having to self-isolate because of symptoms?
So last week, it was about 20% of nurses or frontline workers that were doing it. I don't know the exact proportion of nurses in that, 20 to 25%. So there are a number of nurses that would like to be tested to get on with their job if they are not positive for COVID-19.
That does feel like a really large amount at a time when the health service is clearly under pressure as well. The other thing that you said that frontline workers really need from the government is the personal protective equipment. So that's things like masks, gloves, goggles. Is that equipment getting through to the front line?
Well, we are working on it at this moment, and I'm personally working very hard to ensure that nurses get the equipment at the front line. But I think that it is down to sometimes the trust that they're working for to free up that equipment so nurses can utilise it and work and protect both themselves and the patients that they're serving. I'm hearing from nurses on the front line that they're being denied access to masks and aprons, and this has to stop because it is the nurse that does that assessment of who she's providing care to. It's fine in hospitals, but we also need it for out of hospital care because these nurses are going into homes or working as in outreach facilities to undifferentiated patients that we don't know if they've got the virus or not, and therefore the healthcare worker or nurse has to be adequately protected.
Do you think that nurses could be redeployed to different parts of the country to deal with the outbreaks that are happening in quite specific locations? We've obviously seen a large number of cases in places like London and the West Midlands.
So I think there are some moves to do that. We are estimating that a lot of nurses will be needed to deliver critical care, and we know that we're just about to open up Excel with extra beds. So I am expecting nurses to be redeployed. I guess what I would say is that actually we need those nurses to willingly volunteer to do this, as opposed to being forced to go from one part of the country to another. And actually, we do need nurses who are already working tirelessly to step up if they've got those skills and offer them to the services that require them at this moment in time.
And just finally, we've of course seen the really worrying figures from death rates, infection rates over the last few days ratcheting up. Do you think the NHS has got the capacity to cope with what we're likely to see in the weeks ahead?
Well, much depends on if we all obey or listen to the advice that we're being given. It gives the NHS a fighting chance to save lives if people do remain indoors and are not spreading the virus, so that actually the NHS can cope with the patients that it's already got. So I think it's really important for us to listen to that advice, to wash our hands, to stay indoors, to do the things that we need to do to help the NHS to be able to save lives.
OK, Dame Donna Kinnear, thank you very much for being on the programme today.